Okay, so what I'm going to do is I just want to do a 10-minute presentation of the skull. One of the things you'll notice by looking at the exploding skull here is that there are a lot of bones, and a lot of the things that you actually can point out, it would be easier just to have a sheet and being able to label it. But by having a basic understanding of how things are named, it will help. So what I'm going to start with is start with the whole skull here, and I'll jump from one skull to the other. So what I will start is with this bone up here. You see me? This bone here is your frontal bone. It's separated by this suture here. Now, if you think of a crown coming here, the main thing would be here. So this is a coronal plane. That suture would be the coronal suture. The coronal suture separates the frontal bone from the two bones behind it, which are your parietal bones. And the parietal bones have a line going straight down here too. This line is a sagittal line. It's actually called the mid-sagittal line. And so the suture is called a sagittal suture. So now you have a frontal bone, two parietal separated by the sagittal suture. The parietal bones are separated from the frontal by the coronal suture. If we turn it around, we see a little L-shaped pattern here. Well, it looks like a lambda. And so we have the occipital bone separated from the bone behind, which is called the occipital, by the lambdoid suture. And so we have the main sutures there, and we have the biggest bones that form the calavera. Now, if we turn it to the side, I'll turn this one too, we can see the bones that we've already talked about, the frontal, the parietal, the occipital, and we can see this one here, which would be here on the skull. This bone is called the temporal bone, and if you think of going gray, you can see how you tend to go gray on this side more than everywhere else first. So it shows a sign of time, not on me because I'm gray everywhere now. And so this is a sign of the bone that shows a sign of time, which is the temporal bone. This area here is relatively flat. And if you did histology, you know that a flat cell is called a squamous cell. This area is called the squamous portion of the temporal bone. And the suture here is called the squamous suture. Now, if we look here, you can see that there's another suture. The same suture, the squamous suture, is with the sphenoid bone, so it's called the squamosphenic suture. And you have the bone here called the squamous, this bone here, which is called the sphenoid bone. Now, we have the occipital, the parietal, the frontal, temporal, and the sphenoid. And this technically is called the greater wing of the sphenoid because you have a lesser. If you follow the temporal bone, you have the arch. And over here, it connects to the zygomatic bone, which is a cheekbone. The arch is called the zygomatic arch. And here's one of the first projections that I'm going to talk about. Now, a lot of projections, if they're touching another bone, are named for the bone that they're touching. So this is a temporal bone, but the projection is touching the zygomatic. So it's a zygomatic process of the temporal bone. Process just means a extension of bone. On the zygomatic bone, we have this little projection of bones coming to the temporal. So it's a temporal process of the zygomatic bone. So we can actually see all these muscles here. There are a couple other processes that I'm going to talk about while I'm here, and one of them is this one here, called the Mastoid Process. Mastoid means breast, and to someone, this looked like a breast, so they called it the Mastoid Process. Now, if I remove the mandible, we can see the styloid process here. A styloid is a writing instrument, so to someone this looks like a styloid process. And between it, we have the external acoustic meatus, which is your ear canal. Now, if I use myself as a model, temporarily, behind your ear here, you have the mastoid process. External acoustic meatus, and the styloid process you wouldn't be able to see. So we have most of the bones that you can see on this lateral view. Now I'm going to rotate it here so you can see these bones here. These are the facial bones. So we have the frontal bone. Here we have the nasal bone, which is making the nose. And next to it we have the maxilla. Now the maxilla has a spine here on the nose, which is called the nasal spine. And it touches the zygomatic bone. So that projection here is a zygomatic process of the maxillary bone. just like here you have the maxillary process of the zygomatic bone. Maxilla comes in here, but you can also see a suture here with a hole right here. This bone is called the lacrimal bone, which to lacrimate means to tear up. This is the lacrimal canal, which goes into the nose, and that's why when you cry, you get a runny nose. You can also see the sphenoid bone, the greater wing here. And over here you have the ethmoid, which you can see part of it here, and you can see the perpendicular plate of the ethmoid bone here. Now, as we're looking at the eye, I want you to think of this area as the orbit of the eye. This hole here is underneath the orbit, so it's your infraorbital foramen. Foramen means hole. Over here you have your supraorbital foramen. Turning it around, we can see the maxilla here, and you see that there's a division of bones. You also see a line coming down here. The maxilla comes in contact with the palatine bone here. Now, if the maxilla and palatine, this little suture doesn't happen, you can end up having a cleft palate. Now, as we come over here, we can again see the occipital bone here, styloid process, mastoid process, stylomastoid foramen, and the foramen magnum, which is a big bone. Now, all these holes have different names. You have the carotid canal, the jugular fossa, the sublingual canal here, but those are easier to see in a picture and where you can actually look at it. Ovale, an oval hole, spinosum, lucernum. And so we actually have gone through pretty much the bones of the skull, except for one. In the nose, we can actually see the vomer here. And if we open this, we can actually see other things. But I am going to give you one other clinical bone, and that's this H pattern called a pterion. It's PT, when you actually spell it, PT. The reason that place is important is it's one of the softest parts of the skull. If you look here, you can see where the pterion would be. Now, by opening the skull, if we look at where the pterion is, we can see that there is, if I can see it, there. Trying to find there it is. And we can see the pterion here. We can see that there's blood vessels around here. If that breaks, it can end up causing increased intracranial pressure. Now, I'm going to show this inside because if you're doing neuro, you actually can use the bones to determine where you're at. So you have the occipital bone here, and the occipital lobe of the cerebrum comes here. Over here you have the temporal lobe, which is where the temporal bone, which is a temporal lobe, tends to sit in. You have this part here called the petrous portion. You have the sella turcica, which looks like a chair, which is where the pituitary sits. And the frontal bone here, which is where the frontal lobe. Over here we see part of the ethmoid bone again, and we see a bunch of little holes which make up the cribiform plate. Over here you can see the little rooster comb, which is called the crista gallia, or crista galla. And you can see the parietal bones here, which is where the parietal lobes would be. So with that, you have a basic understanding of the skull. That is the mandible. The only other thing you want to look at is the mandible. Now the mandible has these knuckle-like projections called condyles. I'm going to show you the skull here because the skull also has condyles. These are the occipital condyles here. These condyles would be the mandibular condyles. You also have the coronoid process here, which means crown-like process. You have a projection here called the mental process, which if you think of me here, if you think of my chin here, if you're thinking, you're doing mental process, so this is your mental process. The holes here are your mental foramen. I'm not pointing to it, here it is. The hole here is a mental foramen, and the process that holds its teeth is the alveolar process, which is the same as you would have here, the alveolar process. Turn it around. And so one of the things I'm hoping you're noticing is that the styloid process you're going to see in a lot of different bones. It's just part of the bone. It's just, anytime you see stylus, it's here. Anytime you see a knuckle-like projection like these or these, it'll be a styloid process. It'll be a condyle. Usually they are paired.